Hello everybody, it's Bram Duffee back with Health Communications class. Today we're going to be looking at chapters 12 and 15, which is all about new technology and how that technology impacts or makes a difference when it comes to health communication. So, some statistics out there, everybody's doing it. 80% of internet users search for health information online. That's like huge, almost everybody. So like of internet users, 66% have looked up information about a disease or condition, 56% about medical treatment, medication and procedure, 44% about a healthcare provider to find out about them, 36% about a hospital or clinic, and 25% about health insurance, stuff like Medicare, Medicaid. The thing is that going to social media, going to the internet, going to the resources that we have become a first place to look in a lot of cases. And back in the day, we would do things like ask for our family members who are connected with medicine for advice, or the little amount of research that we could do on our own was pretty limited. And now it's vast. But with all of these different opportunities come problems. So we're going to talk about how awesome it is. We're also going to talk about some of the problems with health technology out there. And so one of the first things to mention is the fact that we now have electronic health records. I think it's really funny that back in the day, we used to have clipboards that had a spring in them. They were metal clipboards that had a spring in them that held everything with the patient's chart. I actually have one. I think it's over in my bookshelf that I had from when I got to work in a clinic when I was a kid. And the world's changed a lot since then. And we all can recognize the importance of everyone being able to look into an electronic chart, right? So what that means is that the specialty doctor and the emergency room doctor and the emergency room nurse and the family doctor, all of those people that might be involved with your life in healthcare can all see the same thing that one another is involved with. And so it's not across the board, but I can say that there are lots of instances where these connections, especially in the same hospital network, allow for that. And so electronic health records are these digital versions of a patient's paper chart. And they're really critical for storing the comprehensive health information. The way that this works is it's just allowing for a better coordinated effort and more efficient care. So it's like this one-stop shop for your health data, and everybody can get a hold of it that is able to log in electronically. Okay, so that's one of the big differences that there's to mention. And with that also goes the patient reports that you get. So that means that your lab work can be seen by everyone, and your imaging reports can be seen by everybody. So all of this stuff seems like it's a no-brainer, but the truth is that in my lifetime working in healthcare, I've seen us not have it. So it's a massive deal when nurses go on what they call downtime, or when they have to have the computer system changed over or turned off. And it's also situations that I've seen happen in disaster kinds of scenarios where everything's now done by paper and everyone is a hot mess because the communication is now not what it was. You have to be at bedside to be able to see and know and do stuff, really. So that's the difference that electronic health records make. And the thought of moving, from writing a record on a paper for a patient to typing it, till now we're at a point where we can have the narratives for the patient care reports written for us based on information that we put in. So a lot of development has happened from that, because physicians used to do a lot of dictation, and that dictation would be transcribed by someone else, and that someone else would then move this into the record. And so all of that is stopped now, because the doctor either has a transcription device that does voice to text, or they are working with a scribe type person that would participate in that for them. So all these different things have added to and allowed for much better communication about you as the patient. So that just adds to on-the-spot decision-making that's easier, and it allows for things to be more productive. The next thing to mention is telemedicine, and I think that telemedicine has been around for a long time because we have this thought that, gosh, wouldn't it be nice if we were in the middle of nowhere to be able to talk to a doctor, or wouldn't it be nice to, be able to reach out? I will say that when we look at telemedicine, it absolutely blossomed during COVID, and now we think about this as an option more and more for our health. So like, for example, myself, when I have regular medicines that I get from my doctor that I have to go see the doctor for like every 3 months just to do checkups. But if I need an urgent care kind of experience, then it's very easy for me to use something like telemedicine, where I can open an app that supported my insurance company that would allow me to work with that. The downside to these telemedicine appointments are that the diagnostics just aren't there, right? So we're not at a point where we can get on a video call with a doctor and then do the lab work and do the x-rays, imaging, or whatever else needs to be done. So we can get a good idea about what's happening, but really the telehealth is great for only limited circumstances. But I will say that this technology has been a game changer when visiting a hospital is challenging, and it just allows for continuous access to healthcare services. I know of cases where you have a very remote location where they might have a paramedic that's on staff all the time, and then that paramedic is connected through a telemedicine to a physician somewhere else. So what happens is that the paramedic can be the eyes and ears to do stuff with and to the patient in their absence. So that's been a really common thing if you think about like really remote locations on ships, or if you're on an oil platform. These kinds of places would normally be known to do stuff like this. The digital age that we have has really transformed how we seek and how we share health information. And because we're able to be more proactive now by searching for information on our own, then it's just empowered individuals to have a different approach to their health literacy. And it's made folks be active participants in their health decision making. At the same time, the effective sharing of this information ensures that everyone involved in the patient care is on the same page. So what we allow for is the seeking and the using of information back and forth. And at the same time, we have to recognize that there are limitations, and the professionals that are using the information are at a real advantage because they know what they don't know, right? And so they know what they aren't able to do through telehealth. They know what they're not able to see in person, but by looking at the electronic health record. But at the same time, the user is not able to fully reach out the other way, right? So we worry about things like the different concerns that can come with knowing just a little bit about something and not being able to employ that knowledge the right way. So let's just open up the topic more about internet in general with healthcare right now. Internet-based interventions have like this wide array of opportunities for disease management and health promotion. And these interventions range from information websites, even like sophisticated self-management programs that work to help people with their health behaviors and their health outcomes. And if we think about anything from the realm of working to do diabetic monitoring and improving of continuous glucose to health benefits, to just reminders to take your medicine, all of this stuff gives a lot more personalized help, to people who have health problems. And the effectiveness of these interventions really hinges on the ability to engage people, and they do provide a tailor-made interactive content that helps them through their health journey. Internet-based interventions are just starting to become the cornerstone of health promotion and disease management strategies, because these interventions take this whole power of the internet and an audience that is ready for that information and just is able to channel it the right way. And we're looking at solutions that are going to help a wide audience. And so we're looking at everything from simple information websites that provide health information to these complex self-management programs that give them a health improvement plan. So think about like someone that's working to build muscle and working to strategize through that. We know that lots of folks use apps to decide what exercise to do when and about their eating plans. And so one of the key advantages of internet-based interventions is that you don't have to worry about geographical barriers, right? And so the resources are just there with you all the time. And having something that's this personalized is just another great benefit, because the algorithms that are out there allow people to tailor the content to meet whatever needs that you have as a user. And so I'm thinking about weight loss, or I'm thinking about building muscle, these kinds of changes that folks would be working on that are behavior based. This is right up the alley for something like that, because like a weight management program can adapt the recommendations based on just what you're doing throughout the day. You got this many steps in, you've had this many calories, these are your goals, then this is what needs to be done still yet. This kind of motivation can help. And part of that is engagement. Things that are out there like forums and quizzes and progress tracking, sort of like the gamification strategies that are out there, like where you can earn badges or reach different levels. All of this can help with engagement, and also it can be fun. So these kinds of things are just designed to start folks down the path of solidifying health behaviors that they need. And if we think about someone who's spent their whole life not thinking about what they eat, or not thinking about what muscle group they should be working on, or thinking about their lifestyle, it's important to have something that can be a crutch to get you there. Similar to anything when it comes to breaking a habit, we have to have these things of motivation to get by. This is why people that go to the gym with a buddy are more successful, because they have that other person to hold them accountable and be there with them. Same thing happens with some of these internet-based health interventions, because you have something there that's holding you accountable and helping you stay motivated. And so studies have shown that improvements in a range of outcomes, from things like physical activity, healthy eating, better management of things like even depression, can happen from these programs. So the widespread adoption of smartphones and all this wearable technology has really added to this. And so what can happen now is we have wearable technology that can stay connected in a way so that we get continuous monitoring of things like sleep patterns and oxygen levels and intake of the calories and expenditure of calories, and just all of these continuous glucose monitoring. So all of these different things that seems like you're an ICU level patient, but having data is really powerful when it comes to behavior change, because if you can use that to be motivating, then that's a tool that I think a lot of people are finding is a big time success for them. And if you have spent years and years smoking, or if you've never ever worked out before, or if you've never thought about eating right, these crutch things are really powerful. So just the immediate feedback that a lot of stuff gives, I think that is really nice, along with the level of personalization. There's an emergence now of some different health games out that work to introduce health education to this behavior modification. And they're always designed with a specific health outcome in mind. And it's just designed to be able to try to make the activity more enjoyable. So trying to take elements of fun, maybe like competition, reward, these things that would sustain engagement and lead to improved health literacy. So this kinds of approach is designed for that purpose, behavior modification. And so, unlike traditional methods which rely on passive learning techniques, where you have to do all of the stuff as you go, these health games are just set up like games to be more interactive, and they don't just engage users, but they work to try to keep them prompted. And this kind of application of game and design elements can be a really pivotal role for the health games in people's lives. And so we think about elements that transform mundane, boring tasks like learning about nutrition or some kind of chronic condition into an enjoyable experience. Just the fact of having the correct prompts. One of the ways that I see this working is not just with people who are able to get prompts like this and get feedback from the computer, but also sometimes opportunities to interact with other people. So similar to like Weight Watchers, only that kind of connection in a game. So all these different ways that we can see that this can transform to really help with positive motivation. When we think about all of this kind of topic, social media also plays a big role in how it interacts with e-health. And social media platforms are really set up for community building and peer support. And so it's not just about sharing health experiences, it's also about finding information. I'm sure a lot of you have had an opportunity to brag about your health progress or show off how you have done things on outdoor walks or maybe time in the gym. And when you brag about those kinds of things, what it does is it reinforces that you are this kind of person. You're this kind of person that goes and does walks. You're this kind of person that spends time in the gym. And this becomes part of your image, part of who you are. And so it's like taking another step forward into it. And so I know that there's a lot of funny talk about people that are annoyed by folks that post a picture of themselves every time they go to the gym. But we can see that this is what's motivating that person. And so the thing that motivates one person is not always going to motivate someone else. But there's this multifaceted opportunity to share experiences and really foster connections between people and even health organizations. And so I just think about platforms like Twitter and Facebook and Instagram and how they allow this immediate exchange of health information. And even just looking down the barrel of their algorithm, you spending time with your friends talking about something like, I don't know, ADHD or PTSD or depression. Just talking about those kinds of things can steer your phone to know that that's information that you're interested in, right? Because it's like they're always listening. So these kinds of things in social media can help you learn more about the things that you're interested in because you've been talking about them. Also, tools for public health, like the immediate things that happen in the environment. We know that for finding out about school shootings or to understand options to where to find testing locations for STDs, no matter what the range of things are for public health, these are obviously going to take a front seat as well. I don't know about you, but on my Facebook, it shows me like a weekly reading about how much time I spend on Facebook. And I don't know how many hours it gives me, but I have a lot of FaceTime. And so there's a lot of things, a lot of communication that happens back and forth with me informing the social media platform what I'm interested in and it giving me the information, right? So this power that social media has right now to give you information and then reinforce information even without you directly asking for it is pretty powerful. And so altogether, we have to recognize that this world of technology has presented a paradigm shift in what can be done in right now in healthcare today. And I think that what we have to do is make sure that we're using this information in a way so that we can move the ball forward in a positive direction and not cause problems for ourselves. And so, one of the things that I've always been an advocate for is having folks write down questions and be ready with those questions written down on paper when they visit their doctor. So that's whether they come to visit, the doctor comes to visit them in the hospital room or the doctor is going to see them in the office. All the time that you get with the FaceTime on technology and through these different avenues, you deserve to be able to talk to the expert to make sure that you know what's right for you and what's not right for you. And so to that end, I suggest that folks write down questions because there might be something that you ask that could really direct the doctor to think about something new or help you learn something new that would help yourself. And so as these tools become more and more widespread, and when I say widespread, I guess I just mean how in depth they are into your lives, because at this point, between the watch that you wear and the cell phone that you have, these devices are finding out a lot about us and the things that we need. And so if we have a wart on our foot, we might start seeing wart ads, right? Or if we have a problem with a toothache, we might start seeing toothache ads. These are things that are showing us that technology has been integrated with us in such a way so that we're going to be getting information sometimes. And so being able to discern what's right and correct for us in some cases might be more of a challenge. And so that's why I say that it's important to not make assumptions, but to write down questions for your doctor. Anyway, this has been a great topic. I like talking about e-health and technology because I've been in an opportunity to see the spectrum of Everything is on pen and paper. Up till now, folks are able to make well-informed health decisions because they get information not just from the doctor or nurse, but also from technology solutions that are out there. And also, I've seen how healthcare has made incredible improvements. If you think about being in a small hospital with no opportunity for specialists, they are in a position now because of technology to be able to scan you and have that read by a specialist, and then the radiology specialist report go to the neurologist or gastroenterologist, or whoever specialist would be most appropriate. So what you end up getting is local care in a middle of the nowhere hospital, but you get world-class evaluations from experts in the field because of this technology. And I think that the only thing left is getting the patients the appropriate treatment, and a lot of times that treatment needs to be done under the direct care of the specialist doctor. So as a paramedic, that's where my role comes in a lot of times, is trying to make all these people be connected, right? Connect them to the correct specialty. So I am excited about what's happening now with technology, and it makes me even more excited about the next 20 years and what's to happen. So I look forward to your written assignments this week, and thanks for talking about technology with me today.